Moxibusion therapy is an excellent cure that can be available only if you have moxa herb. This traditional Eastern medicine treatment is designed to cure diseases by warming the body. It is a gentle but powerful way to treat chronic conditions such as arthritis, neuralgia, and paralysis with no undesirable side effects. If you know the right acupoints, you can easily conduct moxibusion therapy yourself. Because of its easy usage and great therapeutic effects, more and more people are showing interest in it. Members of this association gather to learn about moxibusion therapy and participate in volunteer work to take advantage of it. A wide range of ailments can be cured by moxibusion without any adverse effects. If used for long durations, it can produce amazing curative effects. Many foreign workers who experience this oriental therapy are often astonished by its great effect. This volunteer association was created by acupuncturist Kim Nam-soo to promote moxibusion therapy among the general public. Here, they mostly use direct moxibusion, which applies moxa directly to the skin, letting it burn. So the size of a moxa roll is as small as half a rice grain. Burning this tiny moxa stick right to the acupoints helps restore vital energy and promote general well-being. Even Western medicine practitioners also participate in this group to learn about moxibusion and to do volunteer work with it. They are mainly focused on proving the curative effects of moxibusion from the Western medicine perspective. And a lot of research on moxibusion's therapeutic effects, when used in combination with Western medicine, are taking place based on a variety of clinical trials. Moxibusion is aimed at treating or preventing diseases by stimulating vital acupoints. Its efficacy covers a wide range of ailments, such as arthritis, neuralgia, and gynecological conditions, but it does not produce any unwanted adverse effects. And in the case of direct moxibusion in particular, a different form of protein generated from a slight burn doubles its therapeutic effects.
그 이종 단백질을 만들어낸 데는 직접 이제 뜨는 거, 온열이 아니고, 온열이라는 건 전혀 그냥 뜨뜻하게만 하는 것이 온열 아닙니까? 그런데 이건 화상을 입혀가지고 그 화상에서 생긴 물질이 체내에 흡수되어가지고 그것이 뇌에 전달되어서 뇌에서 조절작용한다. 지금 뭐 과학적으로 볼 때는 그런 거랍니다.
In Eastern medicine, when treating a disease, acupuncture should be first applied, then moxibusion, and finally herbal medicine. This means most ailments can be cured by the first two therapies. Moxibusion in particular was considered as such a significant treatment method that moxa roll manufacturing process, acupoints, and applicable conditions were fully documented in ancient Oriental medical literature. In preparing medicinal moxa herbs, mugwort should first be dried in the sunlight for about 3 years, and then its leaves are ground into moxa wool. Only when processed in such ways, it can produce gentle but penetrating heat. Depending on a patient's condition and applied acupoints, the size of moxa rolls is different. Moxibusion therapy is especially good for cold-induced diseases. There are many clinical cases that have proved moxibusion's curative effects. This patient is receiving treatment for a severe leukorrhea condition. According to Eastern medicine, leukorrhea occurs when the body remains cold, which is, in return, caused by the improper flow of vital energy, qi, and blood. To promote the general flow of qi and blood, acupuncture and moxibusion therapies are most widely used in Eastern medicine. But of the two, moxibusion produces much greater therapeutic effects when the disease is related to the patient's cold body. In this patient's case, she has gotten much better after 3 months of moxibustion treatment. This is her body temperature test result before receiving treatment.
그렇죠. 예. 보다시피 뭐 굉장히 몸이 차게 나타나고 또 발도 차다든가 이런 상태로 나타나고 있어가지고 배가 차고 무릎이 차고 발이 차고 손끝도 차고 그래서 전체적으로 순환이 안 돼서 차다고 볼 수가 있는 상태도 있고 특히 윗배 아랫배가 다 차고 냉하기 때문에 소화에 문제도 좀 있겠고 또 여성의 생리 기능이라든가 이런 것의 기능도 많이 약한 걸로 나타날 수가 있습니다.
The test result image shows that her hands and feet are so cold that they're almost invisible on the screen. And the temperature around her knees is also very low. Low temperature through the whole body is a typical symptom of leukorrhea patients who are having qi and blood circulation problems. In Eastern medicine, moxibustion alone or the combination with acupuncture is generally used to treat leukorrhea. In this clinic, direct moxibustion is in more frequent use. To leukorrhea patients like her, moxibustion is applied to such acupoints as samungyo and inmekhyur, which are vitally related to the physiology of women. The size of moxa rolls can be different depending on a patient's condition, and if the patient should feel that it is too hot, it should be removed before it burns the skin. To confirm that she has really gotten much better, they ran another body temperature test on her. Moxibustion is supposed to cure ailments by stimulating acupoints and promoting qi and blood circulation. The result of the temperature test shows that the patient has really gotten a lot better. The temperature of her hands and feet went up so noticeably that their colors showed on the screen, and the overall temperature of her body rose up to normal, which means qi and blood are now circulating well. We can't attribute such improvements solely to moxibustion therapy, but to a large extent, the test verifies that moxibustion works well.
뭐 치료 받은 지는 한 3, 4개월 됐는데요. 전에는 받기 전에는 뭐 손발도 저리고 차고 양말도 신고 잘 정도로 그랬거든요. 그랬는데 뜸 뜨고 나서는 많이 좋아졌어요.
이런 방법들이 치료하는데 많은 효력을 갖고 있는 걸 갖다가 지금까지 임상적으로 입증을 했고 또 실험적으로도 지금 검토를 하고 있고 그래서 뜸의 효과가 어느 질환에 어떤 효과가 있다든가 이런 것에 대한 것이 많이 증명되고 있는 이런 상태죠.
Moxibustion therapy treats ailments with thermostimulation and therapeutic properties of moxa herb. It is a reliable treatment that produces no undesirable side effects, though applied for a long time. Moxibustion therapy has long been passed down from the beginning of Eastern medicine, and it is expected to continue to develop into the next century.